You're 19 years old, lying on a table in a campus health clinic for a routine checkup. The nurse presses her stethoscope to the left side of your chest. Silence. She frowns, moves it slightly. Still nothing. Then she moves it to the right side of your chest, almost as a joke. Your heartbeat is right there, exactly where it shouldn't be. By the end of this video, you'll understand what it means to be a medical mirror image of almost everyone else on Earth. Stay until the end. The final level might explain something about your own family you never expected. Level 1. The discovery. You're 19. You came in for a sports physical, nothing more. You expected 5 quiet minutes and a signature on a form. Instead, the nurse goes still. She listens again. She calls in the doctor. The doctor places the stethoscope on your right side, and there it is. Your heartbeat, clear and strong, exactly where a heart shouldn't be. He orders an X-ray immediately. You sit in the waiting room with your shirt still half buttoned, your mind racing through every worst-case scenario. The X-ray comes back. The doctor calls you in, and the first thing he says isn't reassuring exactly, but it isn't terrifying either. Your organs are mirrored, he tells you. Your heart is on the right. Your liver is on the left, where your spleen should be. Your stomach is on the right. Every organ in your chest and abdomen sits in the exact mirror position of a typical human body. The condition has a name. Situs inversus totalis. You've lived your entire life with your body built backward, and nobody, not your parents, not a single doctor before this one, ever noticed. You ask the obvious question. How is this even possible? How did nobody catch this in 19 years of doctor's visits? The doctor explains that situs inversus is often completely asymptomatic. Your organs work perfectly fine. They're just arranged like a mirror image of the standard layout. Unless a doctor specifically listens to the correct side or orders imaging for an unrelated reason, it can go undetected for an entire lifetime. You leave that appointment with a diagnosis that changes how you'll think about your own body forever, even though nothing about your actual health has changed at all. Level 2. The research spiral. You go home and fall into a research hole that lasts until 4 a.m. You learn that situs inversus occurs in roughly 1 in 10,000 people. Rare, but not impossibly so. It happens during early embryonic development, when a structure called the embryonic node, lined with tiny hair-like structures called cilia, generates a directional fluid flow that tells the developing organs which side of the body to form on. In your case, somewhere in those first few weeks, before you were even the size of a grain of rice, that signal flipped. Your body built itself as a mirror image, and it's been that way since before your mother even knew she was pregnant. You learn there are 2 main types. Situs inversus totalis, a complete mirror image of every organ, which is what you have. And situs inversus partialis, a much rarer, more dangerous version where only some organs are mirrored while others stay in their normal position, often causing serious heart defects. You got the safer version, the doctor tells you. Total mirroring tends to come with no functional problems at all because your organs developed in a fully consistent layout. It's the partial cases, the inconsistent ones, that cause real medical danger. Still, you can't stop thinking about it. Every time you feel your own pulse, you're aware of it in a way you never were before. Every time you eat something and feel a stomachache on what you now know is the wrong side, you're reminded that your body is built differently from almost every other human being who has ever lived. You start to wonder what else about you might be flipped, hidden, waiting to surprise a doctor someday. Level 3. Explaining it to everyone. You're 20 now. Word spreads through your friend group fast. Your heart is literally on the wrong side, becomes a strange kind of party trivia about you. Some people don't believe you until you show them the X-ray on your phone. Some people ask if you're secretly a superhero. Some people get genuinely uncomfortable, like proximity to your mirrored anatomy might somehow be contagious. You start having to explain the same facts over and over. No, you're not dying. No, this doesn't mean you're sick. Yes, your heart still works exactly like everyone else's heart, just on the other side of your rib cage. You bring it up at a family dinner, half expecting it to be old news, because surely someone would have noticed something this significant in your medical history. Your grandmother goes quiet. Then she tells you something nobody in your family has ever mentioned. Her own brother, your great-uncle, who died before you were born, had the exact same condition. He found out during a botched appendectomy when surgeons opened the wrong side of his abdomen looking for an appendix that wasn't there. Because of course it wasn't. His appendix was mirrored to the left side along with everything else. This detail terrifies you more than anything the doctor told you. Situs inversus might run in families, sometimes inherited through a specific genetic mutation affecting those same cilia that misdirect organ placement during development. And it means something far more dangerous than party trivia. If you ever need emergency surgery and the surgical team doesn't know about your condition first, they could operate on the completely wrong side of your body, looking for an organ that simply isn't there. Level 4. Building a safety net. You're 21. The appendectomy story changes everything about how seriously you take your diagnosis. You get a medical alert bracelet, the kind people with severe allergies wear, except yours simply states, situs inversus totalis. Organs are mirrored. Verify before any surgical procedure. You carry a card in your wallet with the same information, plus a printed copy of your most recent imaging. You research what would happen in a real emergency. If you were in a car accident and unconscious, paramedics performing routine procedures like inserting a chest tube for a collapsed lung need to know immediately which side your heart and lungs actually sit on, because the standard procedure assumes the typical anatomical layout. Without that knowledge, a life-saving procedure could become a fatal mistake. You become, in a strange way, your own medical advocate before you've even had a single emergency. You make sure every new doctor's office has your diagnosis flagged prominently in your chart. You repeat your condition to every new specialist, every new dentist, every new doctor, because the standard human body layout is so deeply assumed in medicine that even trained professionals can forget to check. You also discover something that gives you a strange sense of camaraderie. There's a small but real community of people with situs inversus online, sharing stories of misdiagnoses, surgical close calls, and the particular experience of being a walking exception to a rule almost every textbook assumes is universal. One member of the group shares something that stays with you. A famous case of a man whose mirrored heart wasn't discovered until he had a heart attack, and the EKG readings made no sense to the emergency room doctors for nearly 20 critical minutes, because every lead was placed, assuming a heart on the left. You realize your safety net isn't optional. It's the only thing standing between an ordinary medical emergency and a fatal misunderstanding. If this story is hitting you right now, this is the moment to hit subscribe, because the next level is where this condition stops being trivia and becomes something that actually saves your life. Drop a comment with the word mirror if you're still watching. Now, back to the story. Level 5. The emergency. You're 24. You're at a friend's barbecue when sharp pain rips through your abdomen, doubling you over in seconds. Your friends call an ambulance. By the time paramedics arrive, you're barely able to speak, but you manage to point at your medical alert bracelet before the pain takes your words away entirely. The paramedic reads it. His expression shifts. He radios ahead to the hospital, repeating the words situs inversus totalis, mirrored abdominal organs, so the surgical team has time to prepare before you even arrive. At the hospital, the doctor on call tells you afterward how close this could have gone wrong. Your symptoms looked exactly like a classic case of appendicitis, except your pain was concentrated on the left side of your abdomen instead of the right, because your appendix sits on the left, mirrored along with everything else. Without the bracelet, without years of carrying that card in your wallet, a doctor unfamiliar with your case could have spent precious time chasing a diagnosis on the wrong side of your body while your actual appendix moved closer to rupture. The surgery goes smoothly once the team knows exactly what they're looking at and exactly where to find it. You wake up groggy, sore, and strangely grateful for a condition you spent years being anxious about. The surgeon visits your recovery room afterward. He tells you he's only operated on a mirrored anatomy patient twice in his entire career. He says preparation made all the difference, and that patients who don't know their own diagnosis going into an emergency situation face a real and documented risk of surgical delay or error. For the first time, the thing that once felt like a strange medical curiosity feels like something that just saved your life. Level 6. Becoming the educator. You're 26. The appendectomy experience changes the direction of your life in ways you didn't expect. You start volunteering with medical schools, speaking to first and second year students about situs inversus from a patient's perspective. You explain the bracelet, the wallet card, the years of repeating your diagnosis to doctors who'd never encountered a real case before. Medical students take notes while you talk. Several of them tell you afterward that they'd only ever seen situs inversus as a single paragraph in a textbook, an interesting footnote rather than a real person sitting in front of them describing a near-fatal misdiagnosis. You become something like a recurring guest lecturer, invited back semester after semester, because hearing directly from a patient changes how seriously future doctors take rare anatomical variations they might otherwise dismiss as too uncommon to worry about. You also connect more deeply with that online community you found years earlier. You help build a resource page specifically about emergency preparedness for people with situs inversus, modeled after exactly the precautions that saved your own life. A teenager messages you one day, recently diagnosed, terrified in exactly the way you were at 19. You spend an hour on a video call walking her through everything: the bracelet, the card, the way to explain it calmly to new doctors, the fact that her organs work perfectly fine, just differently arranged. She thanks you afterward, telling you that you're the first person who made this feel less like a medical anomaly and more like just another way a human body can be built. Level 7. The family question. You're 28. Your grandmother's story about your great-uncle has stayed with you for years, and you finally decide to pursue genetic testing to understand whether your condition is inherited or simply a random developmental event. The results come back complicated, the way genetics often are. You carry a variant in a gene associated with cilia function, the same kind of cellular machinery responsible for establishing your body's left-right pattern during early development. It's possibly inherited, possibly something that occurred independently in both you and your great-uncle by chance. The genetic counselor explains that if you ever have biological children, there's a higher than average chance, though still relatively small, that they could also be born with situs inversus, or in rarer cases, the more dangerous situs inversus partialis your doctor warned you about years earlier. This knowledge changes how you think about your own future. You start researching prenatal screening options. You think about how you'd explain this condition to a child of your own from day one, rather than the 20 years of silence you experienced before a college nurse happened to listen to the wrong side of your chest. You realize your great-uncle never got the chance to understand any of this. He found out the hard way, on an operating table, in an era with far less medical understanding of his condition than exists today. You start to feel something close to responsibility, not just to yourself, but to whatever comes after you, to make sure nobody in your family ever again discovers this diagnosis through a surgical mistake instead of a calm conversation. Level 8. Living as the exception. You're 32 now. 13 years since a college nurse pressed a stethoscope to the wrong side of your chest and changed how you understand your own body forever. Your heart still beats on the right. Your liver still sits on the left. Every organ in your body is still arranged exactly backward from almost everyone else who has ever lived, and you've stopped finding that frightening. You wear the bracelet every single day, the same quiet insurance policy it's always been. You still repeat your diagnosis to every new doctor, every new dentist, every new specialist, patiently, the way you've done 100 times before, because you understand now exactly how high the stakes can climb when that information goes unspoken. You still speak to medical students. You still mentor newly diagnosed strangers who message you in a panic, recently informed that their body doesn't match the diagram in every anatomy textbook they've ever seen. And somewhere, right now, in a clinic or a hospital or a routine physical exam, a doctor is pressing a stethoscope to someone's chest and hearing nothing where a heartbeat should be. That person has no idea yet that their entire internal anatomy has been quietly mirrored since before they were born. They don't know about the bracelets, the wallet cards, the careful repetition required with every new doctor for the rest of their life. But they're about to learn what you learned. That being built differently doesn't mean being built wrong. That the body assumed to be universal in every medical textbook still leaves room, in roughly 1 out of every 10,000 people, for someone whose heart simply chose the other side. If this story kept you watching until the end, that's exactly why this channel exists. Subscribe for more, and let me know in the comments. Would you want to know if your own body was a mirror image like this one?